Good morning, everyone, and welcome again to our webinar introducing North Carolina's Modified Child Welfare Policy Manual. We are actually going to go ahead and get started so that we have time to include all of the information that I know you are here to hear about. So, as we get started, we will have people still joining us, which is absolutely fine, but we will go ahead and move forward and talk a little bit about this webinar. So it was developed through funding from the North Carolina Division of Social Services by the Family and Children's Resource Program, which is part of the Jordan Institute for Families here at the UNC Chapel Hill School of Social Work. Also, you can see that in the future, a recording of this webinar will be available on NCSW Learn so that anyone who needs to access it that wasn't here today can do so. So one major thing about this webinar is that it actually places emphasis on the updated manuals, the layout and organization, which is a really important first step before we get to those future opportunities that you'll learn more about. They're going to focus more on the specific content changes. So with that being said, we'll take a minute and look at the goals that we've laid out for this webinar. So hopefully by the end of our time together, you will be able to explain the need for and the purpose of the changes that have been made to the manual, including that link to the Federal Child and Family Services Review. Also, you should be able to describe the manual's format and terminology and what that the new version looks like, as well as distinguishing in the manual between what is mandatory and then also what is included as guidance. So many of you have already found the chat box and been able to say hello. So you'll see that there are two options in the bottom left of that box that you're typing in, and that will let you send a message to either everyone, so that everyone who is registered and in the room can see it, or to just the hosts, which means those of us here at UNC. And this chat box will be the primary way that you communicate with us since we have so many people here on the webinar today. So when you have questions or comments, then please use this box to send them in, and we'll try our best to answer all of your questions during our time together. Sometimes this box moves a little fast because we have so many people typing in it, but we do have someone here that is going to help us keep track of your questions and pay attention to when those do come in. Also, a special note about questions. Since this is just one 90-minute webinar and we have over 800 people registered, we know that it will not be likely to address every single question during our time together. We'll do our best and see what comes in and answering those. But in order to get those other questions answered, we will be sending out a follow-up document to all registered participants and posting it with the webinar recording. And on that follow-up document, we will answer all of the questions asked during the webinar, including the ones that we answer today, and any new ones that we have on there. The recording will be located on NCSW Learn and also on the Family and Children's Resource Program webpage for you to share with your colleagues and any other partners that may find the information helpful. A little bit more information about using the icons. So you will notice a drop-down box in the top of the screen, and that includes icons that you can use as an additional way to get our attention. And you'll see a screenshot of what that drop-down box will look like. So now that you know about all of the features of the room, typically this is where we would do a poll to give you a chance to tell us what your role is. With so many people registered, instead we're going to give you a snapshot of who we have registered and here with us today. So with our a little bit more than 800 people registered, we have about 300 line supervisors, about 300 direct client contact or line child welfare staff. We also have directors and program managers or administrators, and those two combined are about 100. Also, we had registered lots of trainer and staff development roles that are here with us. And there are also others registered that work in various different capacities to support this work that we're doing. So thank you all for being here from all of those different roles that you have. So again, I want to welcome you to the webinar. My name is Crystal Coble, and I will be facilitating the webinar today. I work with the Jordan Institute for Families here at the UNC School of Social Work and in the Family and Children's Resource Program. Also from the Family and Children's Resource Program, we have Philip Armfield and John McMahon that will be here for offering technical support. And so now I will let our guests introduce themselves and share a little bit about their role. So we will actually start with Lisa Cauley, so I'll turn it over to you to share us about yourself.
Good morning and happy Friday. This is Lisa Cauley, and I'm the Deputy Director for Child Welfare with North Carolina Division of Social Services. I'm glad to be with you this morning. Good morning. My name is Linda Clements. I am a policy consultant that work at the Division of Social Services, and I'm very happy to be here this morning with members of the work group to introduce this new modified manual.
Good morning. I'm Rebecca Smith. I'm happy to be here to represent both the Policy and Practice Work Group and the OSRI counties. I have 17 years of child welfare experience in 3 different counties and am currently a program administrator in Buncombe County.
Good morning. My name is Tony Carpenter. I'm the Services Program Administrator in Lincoln County. I've served as a non-pilot county, and we're glad that you're here joining us.
All right, again, thank you to each of our presenters here. They've come from different parts of the states to be here with us and to be able to help share this information with you. All right, so now we will go ahead with the information that you are here to listen to. So we will start with why revising the manual in the first place, and so I will turn it over to Lisa to cover information about that.
First of all, it's just time. You've all heard of the CFSR. This is the tool that the federal government uses to understand and strengthen the performance of state child welfare systems. And as you know, North Carolina didn't do as well as we had hoped in the most recent CFSR, which was in 2015. After the CFSR results came out in 2016, North Carolina worked with federal partners to develop a program improvement plan to strengthen our performance. Modifying the manual is part of the program improvement plan. Second, it was time. The last significant revision to the manual occurred in 2004, which most of us probably don't remember, to support the implementation of multiple response, which we do remember. Some parts of our manual had not been updated since 2007, and that was 9 years ago, so it was truly time to do something different with our policy manual. Finally, continuous quality improvement, or CQI, also had something to do with it. In child welfare in North Carolina, we are always looking at doing and asking ourselves what works and what doesn't, and the manual in its current form was not working for child welfare staff. Finding the information they needed was at times difficult, and when the information was found, there were instances where it was not clear or concise. Okay, and this is just to provide some information, some context regarding the CFSR for those who are not as familiar. And the CFSR is really how the federal government monitors the states. But most of us know what the CFSR is. Excuse me, I went too far. Okay. I'm going to talk a little bit about our program improvement plan. Our program improvement plan includes 5 goals. Goal 1, as you can see on your screen, is to improve the outcomes of safety, permanence, and well-being through clear performance expectations. The first strategy under this goal involves strengthening and clarifying our child welfare policies and practices, which is what we're talking about today. Revision of the manual was a priority because we concluded that the lack of clarity in some places in the manual was contributing to inconsistent practice across the state, something that none of us want. We knew we had to improve practice. We knew that to improve practice, we had to improve the manual. We also knew that some of the expectations on the OSRI were not included as requirements in the existing manual. Filling in gaps in content was also critical to ensuring safety, permanency, and well-being for children, the thing we all come to work for. Before introducing the modified manual, I would like to thank the members of the PIP Policy and Practices Work Group and the 10 OSRI counties for their work on the modified manual. This was truly a group effort and required a lot of time and energy on the parts of all work group members. The outcome from this work is going to support improved practice in child welfare through North Carolina. And now I'm going to turn it over to Rebecca, one of the active participants in this work group, and Rebecca will introduce the modified manual.
Okay, so we really worked in the work group to do with several areas of focus. One was to make it very clear what the expectations were regarding policy as opposed to what the guidance was. As we'll show you in a moment, we have reformatted things to make this distinction more obvious. We wanted to make the manual more concise. We felt like the narrative was too heavy in some places in the old manual, which made it difficult to find and sometimes interpret some of the policy expectations. We worked to improve navigation and usability in the new manual, using the table of contents to make it more clear, and we have included more helpful links to make it easier to search. We have also addressed gaps by adding new protocols and making sure information across the functional areas is consistent with federal and state law. We believe you'll agree these changes will make it easier to find the information you need, which will make your job a little bit easier and hopefully lead to increased safety, permanency, and well-being. The PIP Policy and Practices Work Group was given a pretty significant charge in enhancing the policy manual. Initially, the thought was to change the way the manual was organized and formatted to make it more user-friendly. However, through the work the team completed, it became clear there would be a need to close gaps, reduce duplication, and ensure clarity in the policy as well. The county representatives were able to play a significant role in suggesting changes, rewriting portions of the policy, editing and providing feedback through the development of the modified policy manual. Each of the pilot counties was asked to identify a point of contact prior to implementation of the manual in all 10 counties. The points of contact were asked to coordinate the dissemination of the information to the counties. During presentations to the pilot counties, the state representatives from the Policy and Practices Work Group were able to share the changes to the manual and solicit feedback. The state was clear they would accept feedback in any way they could get it, using a feedback form, by email, by voicemail, and through the points of contact. In Buncombe County, we had social workers and supervisors send individual emails, we coordinated service area responses, and we had the opportunity to complete time studies based on the changes in order to advocate for lower caseload standards. A final debrief was held on January 12th, and all 10 counties had the opportunity to share additional feedback. From Buncombe County's perspective, we felt heard. We did not always get what we were asking for, but we did feel we were able to contribute to edits, to ensure policy was clear at the social worker level, to contribute to form revisions, and to express concerns related to some aspects of the policy changes. Overall, the feedback related to the organization and formatting of the modified manual was extremely positive. Now Tony is going to provide additional county feedback from a non-pilot county perspective.
All right, as a non-pilot county, being involved in the PIP Policy Work Group allowed an opportunity for us to make impacts on changes to the policy both in content and format. During the work group process, non-pilot counties engaged their staff in thinking about what could be changed to improve the manual, what forms needed to be adapted, and anything else that could improve the functioning of the manual. The old manual posed significant challenges both from a usability and content perspective. Simplifying the format so it was more user-friendly was very helpful. For example, new items are covered in one area with one explanation rather than multiple areas with multiple explanations. Toward the end of this presentation, we'll say a bit more about plans for implementation of the new manual and how the division and pilot counties will support that implementation. Before that, however, we want to explore changes to the manual in more detail, so I'm going to turn that over to Linda.
Good morning, everybody. Before we jump into actual details of the manual, we're going to talk first about the terminology and framework developed to support our work on changing the manual. So before we actually jumped into just moving content around, we actually looked at what was a framework that would help support that organization and support consistent use of terminology as people applied the manual. And as Tony and Rebecca both have talked about, modifying the manual took a lot of pre-work and thought about what would make it work. So what you see on the slide is what we ended up adopting. We have, for the policy manual, the modified manual that you are being introduced to at this time, first at the top of the triangle you'll see is policy. Policy provides a formal brief statement of requirements. It will tie directly to federal law and North Carolina statutes. Supporting policy is protocol. Protocol is more in-depth and includes specific action steps at a high level, not as high as policy, but helps you with decision-making to meet requirements of policy. These are actions that you must do for compliance across the state. An example of protocol is within 7 days of case decision, and the decision that a case is going for in-home services, face-to-face contact with the family by a county child welfare worker must occur. That is an example of protocol in the new manual. Guidance is the next level. Guidance is kind of how it is suggested or recommended that counties comply with the protocol and policy. We chose the word practice. That was one of the areas of inconsistency in the manual, where we sometimes called things best practice or recommended practice or guidelines, and we wanted again to get for one common terminology throughout the manual, and we landed on the use of the word guidance. An example of guidance in supporting of the protocol I just previously spoke about is that for the initial 7-day face-to-face contact, the family should be, contact with the family should be completed by the in-home service social worker with the CPS assessment worker. That would be best practiced by the county for that to occur with both workers together. And that's why it is a should. Also, that 7-day contact should occur in the family home and include all members of the family. A quick note here is there are times when a county may choose in their county to make guidance a requirement for their staff. They may have an area where they've had a particular practice issue that they are stressing, and so they may choose and have the authority to choose to make guidance a requirement in their particular county. Also, as I talk about this framework, you will see at the very top of the slide purposes and philosophies. One of the things we found is that these overarching visions and principles that are very important were repeated over and over at the beginning of sections in the manual. At this point, they are going to be pulled out and will be in a separate section of the manual, still very critical to the work we accomplish. I just want to re-emphasize in the manual 2 very key terms. As I stated when I was giving examples, protocol and policy are both must. These are requirements for compliance with law and or with what the Division of Social Services along with county staff agree has to happen to make sure our children are safe, achieve permanency, and their well-being is addressed. Should is the other key word that we'll be using throughout the manual, and it is in regards to guidance. This is recommended methodology to comply with the protocol and policy. I also wanted to spend some time a little bit talking about instructions. Instructions are kind of supporting that whole triangle we talked about in the framework. they support both how and what. They're very detail-oriented. They're step-by-step actions, task-oriented, that support specific activities that are required to be done, performed in our work. Examples are what are provided with forms. Many of our forms, the 5010, for example, the 5231 safety assessment, have a document, a separate document, which provides instructions on what has to be done or how it can be done to comply with that. We really have a little bit of both what and how in our instructions, but that's a lower level of requirement that supports this whole pyramid. We also have instructions that are currently in our existing manual that may be how to enter data and use of central registry. The new manual format, as you saw, doesn't include instructions directly in the manual at this time. Those requirements will continue, but it will not be in this new modified manual at this time. So now, Crystal.
All right, thank you, Linda. So we are actually going to take a few minutes here to take any questions that you may have. So I'll give you a few minutes to type that into the chat box. And we would like to focus on questions around the sections that we've already covered. So just a reminder that we have talked about already the why we revised the manual, as well as we touched on information around terminology and the framework with that triangle that Linda spoke about. So while you're thinking of and typing in those questions, the portion that we will get to next is around the format and the organization of the new policy. All right, so we do have a question that came in around, are instructions considered policy/protocol, or are they guidance?
They actually support both. They are, we didn't, in the original framework we had developed, this is Linda speaking, sorry, we actually had a layer under the bottom of the triangle which put instructions under guidance. It is so key to our work to have that step-by-step. So it really is not one or the other. It supports both what has to be done at a very detailed task level, but also has recommendations in it. As we move forward, that's certainly an area you can give us feedback if we need to rewrite our instructions in a way that supports splitting them out. We have not yet taken that on, but it is certainly something we could consider as we move forward.
All right, thank you, Linda. We also had a question around where the instructions for the forms will be located.
At this time, this is again Linda, all forms and instructions that are not modified still exist on the DHH website. As we go through this interim period, some of the modified forms and instructions will actually be posted with the modified form, and we will talk about that location later in this presentation. Before we roll forward by end of the year, this will all be in one place, so you're going to have a little patience as we work that out.
All right, thank you, Linda. We also did have a question around what the major content changes are, and I just want to put a note out there that really the focus of our webinar for today is really the first step of what that new policy manual looks like as far as the format changes and the organization changes. And so what we will share with you is how you will get that information around those content changes and what the next step in this process looks like. But really today we'll focus on the overview of the new manual and not as much on the specific areas of content, and that will be a separate piece of information that will be shared with you. All right, so another question that we had in regards to the central registry instructions, when will they be available in the manual? Is that something that we know at this moment, Linda?
No, that's part of the things we're still working out is how we're going to do that kind of information, if it will be an addendum, because it is an instruction. It is not protocol or guidance. It will clearly be linked as appropriate when we are finished, but exactly how that's going to be tied in as it is classified as instructions, we're still working that out.
All right, thank you for sharing that, Linda. And also I want to share that as we get more clarity on things for the follow-up document, we can add a little more detail there for things that we know at that time. But I will say that as this rollout is happening, there's really been some attention paid to thinking strategically through trying to combine pieces that make sense, and what can we do to make this process easier as all of this information is rolling out to you all. So thank you for the questions thus far. We will have another opportunity to answer questions a little bit later in this presentation. So now we are actually going to switch to focusing on the format and organization of the new manual. So Tony is actually going to start us off with that information.
All right, thank you. One of the things that you will notice when you are reviewing the manual is the change to format. What you'll see is now sections are formatted to clearly differentiate between the policy, protocol, and guidance. You'll notice that sections are shorter. There's the increased use of bullets with less narrative in the protocol. There are more links to other sections of the manual, and information that applies to more than one function now is found only in the cross-function topics. There are page headers, footers, headings, and subheadings are formatted more consistently now to make that process a little simpler. All right, you'll also notice that the organization of the manual has changed. The principles of partnership are included only once in the vision and philosophy section, which contains the overriding and critical concepts for the provision of all child welfare services. It's important to not forget about these core values and family-centered principles in all the work that we do. The modified manual is organized around the primary functions of child welfare services. Here are the primary headings that you'll notice that are listed, which is intake, assessment, ongoing services, which is in-home and permanency planning, adoption, licensing, and then a cross-functional section. The organization should help counties find the information they need more easily. The highlight indicates that will be published first are protective services, intake, assessments, in-home, permanency planning, and the cross-functional sections. All right, what's in the modified manual? As you'll see, the modified manual is organized by function. The functions in the manual are intake, assessment, in-home, and permanency planning. The manual also has sections dedicated to cross-functions required during the provision of intake, assessment, in-home, and permanency planning, where there would be a need for that to be discussed in multiple areas. All right, changes to the functional area organization. The modified manual will have changes to the structure and organization. Each functional area will display its purpose, a table of contents which is linked, and policy and legal basis to explain what is required and the supporting statutory information. Timeframes are displayed so staff can easily determine how quickly a response is required. Some areas also have a flow chart. Protocol and guidance are present to explain how to accomplish what is needed, as well as best practice guidance in meeting the section requirements. At this time, I'm going to turn it over to Rebecca to discuss some examples from the modified manual.
Okay, so this is a screenshot of what you will see in the modified manual if you were to select in-home from the table of contents. It is A good representation of what each table of contents looks like for each of the functional areas, as well as for each of the cross-function topics. If you click on any of the underlined links on the in-home manual table of contents, you will go directly to that section within the in-home manual and will be able to review the relevant information. Please note that throughout the manual, all the chapter titles are gone, so that as changes are made to the manual, there will be an opportunity to move things around without impacting the rest of the manual. As an example of clicking on one of the links, we're going to take a look at initial contacts within in-home services. And so if you clicked on that link, it would take you to the following the information that's on this next slide. This slide shows the breakdown of protocol versus guidance. Throughout the entire modified manual, the protocol section will always be on the left column, and this describes what must be done by all counties. The guidance section will always be in the right column, and this describes what should be done by counties when striving for best practice. This slide also shows the work group's efforts to state the requirements more simply using less wordy narrative and more bullets. The last statement on this screenshot references the documentation of diligent efforts, and the words diligent efforts are underlined. This indicates a link that will take you to the cross-function topic related to diligent efforts. If you were reading through the policy and wanted more clarification on diligent efforts, you could go to this cross-function topic, which is displayed on this next slide. You will again see this cross-function topic broken up into protocol on the left and guidance on the right. As Linda will explain in more detail in the next slide, it is important to recognize that there are protocol components under each cross-function topic. These are requirements that must be met by counties in addition to the protocol identified in the main functional areas. If you were to scroll to the next and final page of the Diligent Efforts cross-function topic section, you would find links that will allow you to return to the table of contents of your choice. And now Linda's going to talk a little bit more about the use of the cross-function topics.
Thank you, Rebecca. Yeah, just want to spend a few more minutes making sure people are clear about our intent when we created the cross-function topics. What we found is that in the current manual, a lot of where we ran into inconsistency is that we had information in many different places on the same topic. And when we went to update the manual, we may have updated it in some places, but not all places. And that led to inconsistency, actually wrong information that wasn't updated, and it impacted both our protocol and guidance. So what we did is we looked what are key functions that support our key functions, I should say, what are key cross-functional areas that support our key functions. Examples would be domestic violence. That is an important concept across assessments in home and all aspects of permanency planning for our children. Use of CFTs applies across all functions, child well-being. So what we've done is we have created the cross-function topics that allow us to write what is required, what is best practice or guidance in each of these areas, and only do it in one place. What it also means, though, which is really important, and we learned as one thing that we really need to stress, is that staff do need to use these links and go to the cross-function topics. There is additional protocol in the cross-function. If you just read what is in your primary function, you may miss protocol that is very important. For example, if you go to child well-being, it tells you in your in-home or permanency planning case what kind of information as far as school attendance, school grades, medical records are required that you obtain on a regular basis and keep current in your file. So as we say on the slide here, don't miss anything. Please make sure that you check on these links and review all the information in the cross-function topics. I also wanted to add one other note that there are some topics that we have not yet converted to the modified manual, but we do have links to the current manual on that information. An example would be conflict of interest or jurisdiction. Some of that information, actually, that part of the manual has not yet been converted. You will find in the modified manual a link to the old current manual for that information. So we've tried to link them together. Unfortunately, this time you're very well may have to use both sets of manuals to complete all the work that you're going to have to accomplish. One of the questions asked previously by a participant was about changes to content. In this manual presentation, we're not going to get into all the changes in content. What we wanted to do is talk about how we addressed and identified those changes to content. How did we decide what was critical and needed to be put here? And it was a multi-step process. Just the step of converting from our current manual to the new format made it very clear when we had an area that we may have had protocol but no supporting guidance, or vice versa. We found some areas that talked about it as shoulds, and would be what we think you should do, but didn't have any associated protocol, or was expected to be protocol but never was said in clear terms that it was protocol. So we had some clear gaps identified during that conversion. We then reviewed the OSRI along with the program monitoring tools to see where there were additional gaps that our current manual didn't even address, maybe something that was in the OSRI. And I'll talk a little bit more about some examples in the next few slides. But another thing is we really looked to eliminate redundancy. We wanted to make sure people could find what they needed and get right to the point. So cross-function topics helped with that, but also we found areas where we just restated the same concept 2 or 3 times in different ways. We tried to state it once consistently and remove redundancy. Throughout our work, we tried to write more clearly to make sure everything was more concise. And we also worked, and we have not finished all of this because we haven't reviewed all sections of the current manual yet. We have been integrating administrative letters that have gone out into this modified manual content, so you don't have to go back and forth. One thing we will also be looking at long term is how we are going to improve our process so that we don't have these parallel processes. So we're making updates to the manual in real time and not requiring this process that exists now where you have to look at both. So that is part of our work group work. The bottom line is, as we looked at content changes, though, we always came back to this primary test. What has to happen to support child welfare staff in achieving safety, permanency, and well-being for the children we serve? So here I am going to talk about a couple of examples of where we either needed to improve clarity, or it was specifically identified as a gap related to the CFSR or specifically the OSRI tool. Child well-being, item 14, which is under child well-being outcome 1, on the slide specifically states that we need to see and discuss and interact with the child individually for at least part of each visit. If it's not done, the OSRI tool requires an answer of no. Based on this gap in policy, we did make changes to our in-home services and to assessments, specifically the family assessments, that requires individual interviews with each child separate from the parent and caretaker, and that this must occur. I wanted to point out that there's quite a few places where we did add protocol. One thing that when we post the manual, and I will talk about that, or someone will later in the presentation, is we do have a summary document that will go with the manual that will actually identify these gaps that were filled, so you don't have to kind of search and find them. We have separately pulled them out, and we will have a separate document that will list these changes to the requirements in the manual. Another opportunity for filling the gap on clarity and with the OSRI was making sure we were more clear around the difference between staffing and supervision, in the manual we specifically address the requirement for staffing. We do in guidance somewhat define the difference between them, but some of the guidance around staffing and supervision, I should say staffing, administrative type work and supervision is a topic that will be addressed in the future. This manual has specific protocol around what staffing needs to cover, the frequency of that staffing by each area, and what must be covered during that staffing. It also gives some guidance around how staffing could occur. This is just another example of a gap that was filled to make sure that the new manual supports consistency across the state and helps us meet requirements for safety and permanency. Now I'm going to pass it back to Rebecca to discuss some of the county experiences.
Okay, thank you, Linda. So yes, we wanted to just take an opportunity to provide some of the takeaways and lessons learned from Buncombe County specifically. And as an OSRI county, we had the chance to pilot the manual kind of in phases, starting in August or so of last year. And as we went through the modified manual, we found it to be very user-friendly and accessible. The feedback related to the organization of the manual was very, very positive. And actually, I've noticed people using the policy more and more when they have questions, when they need information, they're able to access that very quickly. As we used the format, we were able to identify that additional links were needed and that some page numbers weren't working and things like that. So we've hopefully problem solved those as we've gone. We found a trick to being able to enter the page number in the Adobe box at the top of the page and go back to the exact page you were on if you do not want to use the links to get back. Sometimes you have to use the links to go to the table of contents first and then return to where you were. So using those page numbers is really helpful. We realized kind of partway through our pilot that we were not as focused on the cross-function topics as we should have been, that we really focused on the service area specific policy and did not spend as much time linking to those cross-function topics and identifying maybe concerns that we had or feedback that we may have had related to the content. So that's something that we're continuing to work on. Required timeframes and flowcharts are really, really helpful and will hopefully lead to more consistency across counties. I know from working in multiple counties that every county kind of has its own cheat sheet for the timeframes and things that need to be done within the specific service areas. And so this will hopefully help to create some consistency in those cheat sheets because the timeframes and the expectations are clearly listed at the beginning of each service area section. And then the increase in workload due to the clarification of expectations and closing of gaps that was designed to help us achieve better outcomes related to safety, permanency, and well-being has definitely impacted our staff as we have been piloting this the new policy. And so just wanted to share that although we recognize the need for the clearer expectations, we have noted an increase in workload for our staff. And so we do believe and want to advocate for consideration around making sure that the expectations are realistic, that we are really valuing quality over quantity, and really have kind of advocated throughout this process to look at caseload standards. I'm going to turn it back over to Linda to talk about implementation of the manual.
Thank you, Rebecca. Yes, as far as how we're moving forward, and I think this will help with a couple of questions we've actually received. You will shortly be receiving a DCDL that will roll out the schedule for the actual dates of regional meetings that will be delivered by the actually division staff, but also in part with some county staff. These 10 regional meetings across the state will focus on the change to content. What are the main primary protocol changes in the manual, along with changes in forms to support the change of the content in the manual. Also released will be some DIY kits. These DIY kits will be on the supervisor resource section of the CSW Learn, and they are going to be focused on each of the functional areas, assessments, in-home, permanency planning, and another overview kit about the manual. And they will be focused for use by supervisors as they implement the change of the manual, including the primary content changes with their staff in their county. Of course, throughout this implementation, the division will be available for technical assistance. I also wanted to talk a little bit even more about forms. Some forms are new and some are current forms that have been modified to align with this new protocol. I will also in the future and a little further down talk about how we are working with MC Fast for that coordination. As to your question now is required implementation by counties of all this changed protocol will be specified in the DCDL letter, which will come out shortly. But you are able to access the manual now. An updated version was actually posted last night. This is the web page there. You'll go on here and you will click on the link for the modified manual. And you can open that manual now and look at it, play with it, go through it, look for clarification, get familiar with it. Also on the same page as the manual is a document that I talked about earlier, is a new protocol, actually new policy protocol and guidance Word document. Actually, I think it's a PDF that will specifically list by function what is the new protocol and content guidance added to the manual. The last thing on the page where you can look at the manual is also a document that lists all forms used by child welfare in a different format. We have sorted all the forms by functional area. Some cross-functional topics are at the end of this list, and then within functional area alphabetically. This way, if you don't know a form number, and we know how much fun it can be to go to the DHH website and look for forms, this is an alternate way for you to find a form you may be looking for, and you can click right from this new document to the DHHS form. It will open up directly from this new document. This has been something that workers have greatly appreciated. There are actually 2 pages that will post when you go to this manual. The one I just talked about is where the manual, this document about forms, and the document about changes are. The second page lists 15 to 16 documents attached, which are the new or modified forms and new or modified instructions. There are 1 or 2 documents. There was an earlier question regarding the strengths and needs instructions. We have started to address the inconsistencies there. That would have been posted with these new modified forms. Unfortunately, we still had a few details to work out. That modified instructions for the strengths and needs to align with the manual and this protocol will be posted with these modified forms in the very near future. But you're going to find your modified 5010 modified instructions. The forms that are not modified, you still find on the DHH website. Only the forms that have been changed are provided on this new knowledge base website. Questions also have come out about alignment with NC FAST, one of our favorite words, I think. Started in August of 2017, 5 pilot counties started using NC FAST. They've been working with NC FAST to make a number of improvements so it better meets social work practice needs. But work in the last month also started with NC FAST to align it with the requirements of the manual. One thing I want to point out that's been corrected on this slide in your handouts that were sent out ahead of time said that the work on the alignment would be completed prior to July. It will be completed prior to the June rollout of NC FAST. And then we will backtrack for any users of the manual, of NC FAST prior to that to make sure that they understand what has changed in NC FAST to be aligned with the modified manual. So we are working on that. The way information is collected in NC FAST will be corrected at that time to make sure that they are consistent and what NC FAST collects is aligned with what the new modified manual requires. All right, I'm going to roll it back to Crystal.
All right, thank you, Linda. So we told you there would be another opportunity for questions, and here we are. We've had a few come in that we'll address momentarily, but if you have additional ones, then keep those questions coming in, and if we aren't able to answer them today, we'll make sure that they are answered on that follow-up document that we will be posting with the webinar recording. So a few of the questions that came in, we have since answered them since they were posted. For example, we had one on NC FAST, and we had another one on the section about when it would be available. So those are questions that we have gotten answers to. We've also had a few that are really focused on content changes on the manual that were really shown as examples when we talked about implementing the manual. And for those, we really want to make sure that the information that you get is the correct information. And so because now we've shared that, we'll be having the regional meetings and also the DIY kits, and that the policy is now available, then we will save specifics for those questions to when we get to those tools and resources so that we can make sure you have the correct information. So we may not get to all those about the specifics of the policy. But there are a few I want to go ahead and address. So we had one, I believe it'll be best for Rebecca to answer about any data that would support the workload increase or numbers when you were talking about the county implementation.
Sure. So we have started to work on some time studies in Buncombe County to focus on workload management and caseload recommendations. And so we started actually with foster care because in our opinion there were more changes. The majority of changes, or the most changes, were made within the permanency planning unit. And so we focused on that first in doing a time study. So we were able to estimate that a full-time employee works an average of 173 hours each month, and in looking at all of the expectations and activities related to the modified manual, that the total workload, the amount of time that folks would spend on meeting the expectations would be 193 hours, and that would not include receiving new cases, having any placement disruptions, attending required trainings, having days off or time out of the office, or any delays related to NC FAST implementation. And so that was one of the time studies that we were able to complete. We're currently working on time studies related to the other service areas, and would be able or willing to share that information as we complete it. And this particular time study was based on a caseload of 15 children in foster care, which is the current standard, as you all know. And also assumed that 10 of the children were in sibling sets, which of course impacts the time that's spent on each case.
Thank you, Rebecca. She did not know that she was going to need that information, and she just pulled it right up. So thank you for being able to do that. All right, so we'll look at a few more of the questions that we had come in. All right, so for the new forms, will there be any instructions listed anywhere, or will they be pretty self-explanatory?
Thank you for the opportunity to clarify that. The new forms that are posted on the website with the new modified manual do have instructions with them also posted in the most part as a separate document. Another thing I did not clearly explain is the forms by function document that's on the manual page. The second page of that lists what are new forms so that you can see that right up front, what new forms have been created and or modified. Also, if you go through the pages after that, around the forms that are currently existing, and you go to look at, for instance, the 5010 documentation assessment, it will say right after it, this form has been modified, go to the knowledge base for that. So that forms by function page should provide information on which are the new forms and what ones have been modified. The work to implement these forms has been ongoing. The pilot counties do need to know that we did receive feedback around many of the forms, so a number of the forms are different than what you were working with in October and were posted. So what went up last night are new forms based on that feedback from the pilot counties. Some of them are changed. The specific changes are not highlighted. You're just going to have to open them up and look at most of those changes, which are, most of the forms are short enough, it will be pretty clear. Unfortunately, due to a backlog at the division office, none of these forms have yet to be translated into any other language, including Spanish. We are on the list to do that. We actually have forms modified before the manual forms that are still on that backlog. So I apologize for that. You'll unfortunately have to work with existing forms and kind of modify themselves as you use them. That is not an ideal situation, and we certainly have highlighted to powers to be that that is a challenge.
All right, Linda, we'll continue on with a few of the other questions that I believe we may be able to get answers out to. Is there a list of forms that were modified versus those that were not modified?
I think, well, I tried to answer that. Again, if you open that forms by function list, the first page is kind of a table of contents that shows the different functions, but page 2 specifically lists all the modified forms, and then page 3 through the end lists all the forms that are available for use. So not only are they listed, the new forms listed and available to open on the knowledge base page, that forms by function document clearly lists which ones are modified.
Thank you. And while we're on the topic of forms, for those counties that are already using the pilot forms, have any of the other pilot forms been modified again?
Yes. When the version posted last night includes modifications based on what we got from feedback. So not everyone's been modified, but some of them, in particular, the in-home home visit contact record has been reduced in size. Some of the boxes around priorities from previous visits and follow through, workers said that wasn't of value, so it's been taken off the form, and we've clarified some of the questions. That's just an example of some feedback that modified the forms that are now available on the knowledge base.
All right. One of the next questions that we had come in, for new employees going through pre-service, will they be trained on the old or modified manual?
Staff development has made a very big effort so that when they talk in pre-service and any of the 200 core areas, they have a little cheat sheet and they train both simultaneously. They are working very hard to update all of their curricula so that by middle of this year, all of the curricula will then be aligned with the new manual, with the expectation by mid-year everyone will be using that content. So there is work, and when people are invited to current training, my understanding is they are asked to bring the version that they use in their county, and the trainers are trained on both requirements.
Yes, Linda, and I will echo that from the work that I've done with staff development people and the courses that I train them with. They are training both the old manual and the what we were referring to as the pilot manual, and participants were asked to bring whichever manual their county is functioning under. So I'll second that, yes, that is what's going on as far as training. All right. Lots more questions coming in. See what next ones we could answer. A few of these we have gotten to again. Will a cheat sheet be available to share with all 100 counties?
I'm not sure if you mean a cheat sheet regarding what's changed. I think again that document, new policy protocol and guidance, that is approximately a 20-page document that goes by functional area with some of those changes. I don't know if that will help you. As far as we did with the pilot group, put out a little bit of a cheat sheet of how to do searches in a PDF, how to do some bookmarking that Rebecca talked about. That document was taken down because it also had information that applied to the manual itself only during the pilot. We are looking at reposting an updated version of that. If any county in the pilot already has a version that they've used with their staff on cheat sheets on how to work with the PDF, let us know. We would greatly appreciate that input. Did I answer the question?
I believe so. I believe referring to that document, the 18 to 20 page document that's posted with it. It's not titled cheat sheet, but it was very helpful for me in looking at the overall areas of the changes. So yes, thank you. All right, since a go live date for all counties has not come out yet, what is the expectation for counties in operating by the modified standard, especially if reviews are being conducted in the interim?
Right now, as far as the OSRI tool, I mean, that tool will not change. The requirements for compliance are consistent. You need to work with whatever policy manual your management tells you you need to be using. As far as the program monitoring tool, it is still monitoring what is currently the expectations of the current manual. It is in the process of being updated and will be, I believe, July 1st updated to monitor for compliance to the new manual. As I said before, the DCDL will be going out soon, and it will list the times of the regional meetings and will also provide a drop-dead go live date for all counties. That's around sometime mid-year. I don't know the exact date, and it will be provided at that time. Does that answer?
I believe so. All right, can counties begin using updated forms and policy prior to the official implementation date?
I would say yes. We are, the pilot counties have been using it. They've found it helpful, especially the county. There is no, if you, as a county, choose to start using the modified manual, in most cases it just increases and clarifies requirements. There aren't places where it eliminates requirements, so there should not be an issue. Would anyone from the pilot, Rebecca, would you like to add to that at all? No.
All right, thank you. So for those of you that are excited to jump in and start doing this, looks like we have the go-ahead to start looking at those changes. Linda, I'm not sure if any of the other questions as they've come in you feel like are ones that we can look at now. What I will say to some of the questions that are maybe a little more detailed or not necessarily able to answer now, we will again have those on the follow-up document so that we can really answer them in detail and get you the information that you need.
I did want to answer this last question that went up here about the date of the forms. Unfortunately, the work to update all the new forms was completed 10 o'clock last night, so the manual's updated. The forms there are all the latest version. The date is not always March date. Some of the latest revision to the forms did occur in the November, December, January time frame. So that's the date that there. It is updated from the October version. So what is there now is the most current date. I will also say, though, in the next month, as we are working right on the design of NC-FAST and how it's going to align to these forms, there might be some minor tweaks to the forms, even as posted now, for consistency, just because the way it's going to work better in NC-FAST will, by modifying the forms now to support people in that conversion, will be better, but the general information will be consistent.
All right, Linda, thank you again for letting us put you on the spot there with quite a few questions. And again, the ones that we did not get to, we will be able to get answers to you that are hopefully a little more in-depth and can get the information that you need. So next, we are going to switch it over to Tony so that he can really provide us a wrap-up of the information that we covered during our session here together. Tony, so I'll go ahead and switch it over to you.
All right, thank you. As a wrap-up, the whole purpose of making changes to the manual was obviously to improve performance across all service areas. And if you see, the manual has been strengthened by making it clear what is required regarding policy as opposed to what is guidance, making the manual more concise, improving navigation and usability, addressing gaps, and making sure information across functional areas is consistent with federal and state law. We believe you'll agree these changes will make it easier to find the information you need, which will make a very, very difficult job a little bit easier and hopefully lead to increased safety, permanence, and well-being for families across the state. Thank you.
All right, so we have provided a lot of information today about the format and organization and the changes in the updated policy manual. And so what we would really like you to think about and type into the chat is that one thing that you will do in response to what you have learned today. I know there will be many things, but let's start with some of those first things that you or your team will be working on in response to all of the information that you have learned. We know that a lot of you are participating in groups, which is absolutely fine, so your group can just post some of what you come up with. So I'll give you a few minutes to type those answers into the chat box. So it looks like a few people have tasked themselves with getting familiar with the new policy before it's implemented. I'll try to look through some of these. It does move fast when you have this many people in a webinar. So we'll just pull out some of them. Providing your team with the PowerPoint and reviewing the information. I think thinking through how you'll review this with your teams is a very good next step so that we can continue the process of rolling out this information. Reviewing our current training curriculum to assure we are training the most current policy. Sounds like we have a staff development person there thinking about what that looks like in their role. So yes, it would look different, and it's good to see that we have lots of different roles here so we can think about how to support counties as we're working on rolling this out. So I mentioned utilizing the forms by function rather than digging through. I do really think that that is going to be a place where it will be actually really helpful for not having to dig through for those different pieces. You can use those areas, and then also the cross-function topics, which was really meant to reduce some of that redundancy and duplication there. So I really think that you will find that information helpful. All right, so as you can see, there are lots of different ways that people have come up with thinking through what to do next. We have lots of people typing, so I'll give just another moment for people to add that information in the chat box. All right, so we did have someone just ask if they can get an electronic copy of the PowerPoint, and the answer to that is yes. In the handouts that were emailed to you as a registered participant, the front page is a form that has links to other resources, but after that are the slides that are from this presentation. So that should have been emailed to you, or there is a link to download the handouts at the beginning that we can make sure we get to you. So if you aren't able to get them, it looks like John just put the link in the chat box. So that should get you to the handouts if you, for whatever reason, didn't receive them through email or don't have them. I did want to call out that someone said that we could be green when we're looking at the policy by not printing all those pages and looking at it online. So thank you for sharing that, and that does work for some people. So again, thank you for sharing all of your ideas on what we will do in response to all of this information that has been shared today. All right, here is the presenter contact information for our presenters that were here with us today. I do want to say thank you to each of them. They each brought a different perspective that was very helpful, I think, in pulling together this information and making sure that we could get the best information to you during our presentation today. So their emails are here. If you have specific questions for them individually, then you can reach them.